So as we just named, this was rectus capitis posterior major, obliquus capitis inferior, and obliquus capitis superior. That leaves one more suboccipital muscle to name, which is rectus capitis posterior minor. We have a superior and inferior obliquus capitis muscle, and we have a major and minor rectus capitis posterior muscle. What's unique enough is that rectus capitis posterior minor is superior to rectus capitis posterior major. And that kind of follows the minor-major pattern that we see with different muscle groups. Just like zygomaticus minor and major on the face, in which minor was superior to major, and rhomboid minor and major we find on the back, in which minor is superior to major. So it always seems to be minor over major. But this will also help us in remembering their attachment sites. Rectus capitis posterior minor attaches to the medial aspect of the inferior nuchal line. Now, what is the inferior nuchal line? Well, we know that we are on the occipital bone, and this right here is the external occipital protuberance, or EOP, of the occipital bone. And on either side of this, we have our superior nuchal lines. So below that, or inferior to it, we have our inferior nuchal lines, which is where both rectus capitis posterior muscles attach. Rectus capitis posterior minor inserts or attaches on the medial aspect of the inferior nuchal line, and it also attaches to the posterior tubercle of our C1 vertebra, or our atlas. And based on that attachment site and the fiber orientation, it's what gives us extension of the head, which is the only action of rectus capitis posterior minor. Rectus capitis posterior major is major for a reason, not only because its attachment sites cause its fibers to stretch further, but because it has two actions rather than one. So rectus capitis posterior major attaches to the lateral aspect of the inferior nuchal line, as opposed to the medial aspect, as rectus capitis posterior minor does, but it also attaches to the spinous process of our C2 vertebra, rather than the posterior tubercle of our C1 vertebra. So major is bigger. It attaches further.